Hello, my name is Dr. Mohammed Baluch, and I'm Associate Professor of Medicine and Director of Plasma Cell Disorders Research in the Vanderbilt Amyloidosis Multidisciplinary Programs at the Vanderbilt Ingram Cancer Center of the Vanderbilt University Medical Center. This poster is titled Efficacy and Safety of Selinexor, pomalidomide, and dexamethasone, SPD, for treatment of patients with relapsed or refractory multiple myeloma. I have a privilege of presenting this poster, in whose work I was joined by several colleagues from institutions across the United States and Canada, and from Therapeutics in Newton, Massachusetts. Multiple myeloma remains incurable despite the promise of T-cell engaging therapies. No standard of care has been established for patients with relapsed refractory myeloma after treatment with immunomodulatory agents, proteasome inhibitors, or anti-CD38 monoclonal antibodies. Large observational studies such as Locomotion have reported short median progression-free survival of about 4.6 months in triple-class exposed relapsed refractory myeloma with commonly used anti-myeloma agents. However, the vast majority of these patients did not receive Selinexor. Selinexor, an oral selective inhibitor of XP1-mediated nuclear export, approved in combination with dexamethasone in penta-refractory myeloma and with dexamethasone in bortezomib in relapsed refractory myeloma after one or more lines of therapy, is being evaluated with pomalidomide plus dexamethasone for the treatment of relapsed refractory myeloma in the phase 1b/2 STOMP trial. Updated clinical and safety data for the cohorts that received SPD regimens with 40 or 60 milligrams of Selinexor once weekly or 60 or 80 milligrams of Selinexor twice weekly are presented here. The SPD arm of STOMP evaluated SPD at multiple doses and schedules. Study objectives were to determine the maximum tolerated dose and recommend the phase 2 dose of the SPD regimen along with safety and efficacy. Once weekly Selinexor 60 milligrams, the XPD60, was determined to be the recommended phase 2 dose for SPD based on the MTD, and 20 patients were enrolled at that dose. An additional expansion cohort in which patients received a lower dose of Q-weekly Selinexor 40 milligrams, SPD40, was opened in line with the shift away from the MTD paradigm and evolving dose optimization paradigms in clinical development. Efficacy, safety, and exposure of the regimens were analyzed and compared by dose. Response assessments were investigator determined per International Myeloma Working Group criteria. This table shows the characteristics of the patients included in the SPD arm. As of October 1, 2024, 81 patients had been enrolled in the SPD arm. Results for the SPD40, SPD60, and pooled SPD60/80 twice-a-week cohorts were presented. Efficacy outcomes are shown here. The median PFS in the SPD40 cohort was not reached, compared to 9.1 months in the SPD60 and 10.4 months in the SPD60/80 twice-a-week dosing cohort. These figures show the Kaplan-Meier curves for PFS for the entire SPD40, SPD60, and SPD60/80 twice-a-week cohorts, as well as for those patients who had previously been treated with an anti-CD38 monoclonal antibody. The most common treatment emergent adverse events were neutropenia, fatigue, and nausea. Median duration of exposure was 19 weeks in the entire cohort, 28 weeks in the SPD40, 22 weeks in the SPD60, and 16 weeks in the SPD60/80 twice-a-week cohorts. Median relative Selinexor dose intensity was 86.4% or 57.5 milligram per week for the entire cohort, 91.3% or 36.5 milligram per week for the SPD40, 77.5% or 46.5 milligram per week for the SPD60, and 95.8% or 92.8 milligram per week for the SPD60/80 twice-a-week cohorts. The all-oral combination of SBD showed signs of preliminary efficacy and was generally tolerable in patients with relapsed refractory myeloma, including those previously treated with anti-CD38 monoclonal antibodies. Although the overall response rate was numerically greater in the SBD60 cohort, the median PFS was longer in the SBD40 cohort, in which the treatment-emergent adverse events were less frequent, duration of exposure was longer, and higher dose intensity was achieved. These data support the further evaluation of low-dose weekly Selinexor in the ongoing EMN29 trial of SBD40 versus elotuzumab in combination with pomalidomide and dexamethasone in triple-class exposed relapsed refractory multiple myeloma progressing immediately after a CD38 containing line of therapy. Thank you very much.